अस्सलाम वालेकुम स्टूडेंट्स। तो आज हम डिस्कस करते हैं केमिकल मीडिएटर्स को आर द inflammatory mediators. These are the substances which are released during the inflammation and they initiate the process of inflammation and also regulate the process of the inflammation. And this chemical mediator may be cellular derive or the plasma derive. The plasma derive include the complement system, kinin system, and the coagulatory system which form the clots. Whereas the cellular derive include the free-form cellular mediators or the freshly formed. The free form are already synthesized and they are stored in the form of granules and they may be histamine, serotonin, and the lysosomal enzyme, whereas the freshly formed cellular mediators include the nitric oxide, cytokines, chemokines, and the alkylinoic acid derivative, which is a 20 carbon compound. तो सबसे पहले हम स्टार्ट करते हैं फ्री फॉर्म cellular mediators, in which the first one is the histamine. Histamine is a vasoactive amine and it is released from the mast cell, which are the richest source of the histamine, and they are also released from the basophil and the platelets. The agent responsible for the release of the histamine are the physical agents like excessive high temperature or the extreme low temperature. Certain viruses also causes release of the histamine, and a pilotoxin like insect venom, interleukin-1, certain drugs like vancomycin and the morphine, and there is also IgE-mediated release of the histamine from the mast cell. Let's suppose अगर ये हमारे साथ mast cell है and it is coated with IgE antibody and if an antigen come, it activate the mast cell and the mast cell degranulate and it releases a large amount of the histamine. अब बात करते हैं about the function of histamine. So histamine causes the vasodilation of the blood vessel. It also increases the permeability of the blood vessel and it also causes the bronchospasm by causing contraction of the bronchiolar smooth muscle and it also causes itching. दूसरा हमारे साथ है serotonin. So serotonin is also a free-form cellular mediator and it is also known as the 5-hydroxytryptamine and it is a derivative of the tryptophan amino acid. The serotonin sources include enterochromaffin cell, which is found in the stomach, and they also release from the platelets and the mast cell. अब बात करते हैं about the function of the serotonin. So they are similar to the histamine, like they increase the permeability of the blood vessel and they also causes vasodilation in the larger blood vessel. But in smaller blood vessel, the serotonin causes vasoconstriction. तीसरा हमारे साथ है lysosomal enzyme. So the lysosomal enzymes are found in the neutrophils and the macrophages, and these lysosomal enzymes are present in the form of the lysosomal granules. And these granules may be primary granules, which are eosinophilic granules, or the secondary granules, which are more specific granules. And the primary granules, they require higher concentration of the stimulus of the agonist fires activation, and the primary granules releases enzymes which are more destructive in nature, and they are released slowly. And these enzymes include myeloperoxidase enzyme, hydrolases, elastases, depensin, and the phospholipase A2. And the secondary granule, they require low concentration of the stimulus or the agonist, and they secrete very rapidly. And the secondary granule releases enzymes like lysozymes, lactoferrin, alkaline phosphatases, and the type 4 collagenases. अब दूसरा हमारे साथ है the partially formed cellular mediators, in which the first one is the nitric oxide. The nitric oxide is formed from the arginine with the help of enzyme known as the nitric oxide synthase, which form the nitric oxide and the citrulline from the arginine amino acid. And there are various isoforms of this nitric oxide synthase that include E nitric oxide synthase, N nitric oxide synthase, and the I nitric oxide synthase. E means they are found in the endothelium, and the N means they are found in the neuron. And these endothelial and neuronal nitric oxide synthase have constitutive property. They are releases normally or physiologically in the body, whereas the inducible nitric oxide synthase enzyme is released during the process of the inflammation, and it is released in response to the tumor necrosis factor alpha and the interferon gamma. And the action performed by the nitric oxide are the vasodilation. Nitric oxide is a potent vasodilator. Similarly, nitric oxide also causes inhibition of the platelet aggregation, or it inhibits aggregation of platelets. Similarly, the nitric oxide also acts as a periodical and it causes the killing of the microbe. And the nitric oxide is also the endogenous regulator of the leukotriene. ठीक है? It regulates the recruitment of the leukocytes. Now, how the nitric oxide performs its action? So the nitric oxide causes the G protein mediated activation of the guanylyl cyclase enzyme, and this enzyme causes the conversion of GDP into the cyclic GMP. And when the concentration of cyclic GMP rises, it causes the relaxation of the smooth muscle and hence causes vasodilation. So we say that the nitric oxide is a potent vasodilator. अब दूसरा हमारे साथ है cytokines. So cytokines are also the freshly formed cellular mediators, and they are peptide or protein in nature. And the cytokines are released from the inflammatory cells like neutrophils, macrophages, and the lymphocyte. And the important cytokines include interleukins, tumor necrosis factor alpha, and the interferon. And the effects of the cytokines may be pleiotropic or radiodency. Pleiotropic means that more than one action performed by a single cytokine, whereas the radiodency means that multiple cytokine they produces a single or common effect, and the effect produced by the cytokine may be local or the systemic. सबसे पहले local effects. So the cytokine act locally on the endothelial cell, and they causes the expression of the adhesion molecule like selectin and the integrin, and causes adhesion of leukocyte with the endothelial cell. They also act on the fibroblast and increase the synthesis of the collagen. And similarly, they also act locally on the white blood cell and cause the release of the interleukin 6 and interleukin 10 from the white blood cell. दूसरा हमारे साथ है the systemic effects. Systemic effects of the cytokines are due to the interleukin 1, and systemically the cytokine acts centrally on the brain, and they also act on the bone marrow, and they also act on the liver. In the brain, the cytokine causes drowsiness or induces the sleep. They also decreases the appetite. Similarly, they increases the level of cyclooxygenase enzyme and causes fever. In the bone marrow, the cytokine they act on the stem cell and increases the process of the hematobiosis, and hence increase the synthesis of macrophages, neutrophils, lymphocytes, eosinophil, and the basophil. In the liver, the cytokine causes the release of the acute phase reactants, and these may be positive acute phase reactant, which induces the process of the inflammation, and they include fibrinogen, C-reactive protein, lectin, hepcidin, and the ESR. And the negative acute phase reactant they inhibit the process of the inflammation, and they include albumin and the transferrin. अब बात करते हैं about the pyrogenic cytokines. These cytokines causes the fever, and these cytokine may be exogenous, which are the bacterial toxin, or the endogenous. The endogenous pyrogenic cytokines include interleukin 1, interleukin 6, tumor necrosis factor alpha, and the interferon alpha, and the ciliary neurotropic factor. And these endogenous cytokine they causes pyrexia. Normally, the cytokine they increases the process of the inflammation, but there are certain exceptions like interleukin 4, 6, and interleukin 10, tissue growth factor beta, and adiponectin, which inhibit or reduces the process of the inflammation. अब बात करते हैं about the individual effects of interleukins. So the interleukin 1 they produces systemic effects by acting on the brain, bone marrow, and the liver, and the interleukin 4 they causes proliferation of the B cell, and the interleukin 5 they causes differentiation of these B cell into the plasma cell to produce the antibodies. And the interleukin 3 it causes the proliferation of the hematopoietic precursor cell or the stem cell. And the interleukin 4, 6, and 10 they inhibit the process of the inflammation. Hence, these interleukins have anti-inflammatory effect. अब आ जाते हैं about the interferon. So the interferon may be interferon alpha, which is released from the leukocyte, and it has antiviral effect. And the interferon beta, it is released from the fibroblast cell, and it is involved in immunomodulation. And the interferon gamma, it is released from the helper T cell or the CD4 T cell, and it is involved in the activation of monocytes or the macrophages. अब तीसरा हमारे साथ है डाइकोडाइनोइक acid derivatives. Normally, the cell membrane contains the phospholipids. When the phospholipids air to act on these phospholipids, they are converted into the arachidonic acid, and it is a 20 carbon compound. And this arachidonic acid then follow either cyclooxygenase pathway or lipoxygenase pathway, and two other minus pathway like apoxygenase pathway and the isoeucosanide pathway. तो सबसे पहले हमारे साथ है cyclooxygenase pathway. In this pathway, the arachidonic acid is converted with the help of COX-1 and COX-2 enzyme into the prostaglandin G2 and then into the prostaglandin H2. And the prostaglandin H2 then form multiple products. The first one is the prostacyclin or the prostaglandin I2. The prostacyclin it is formed in the endothelial cell with the help of prostacyclin synthase enzyme. And this prostacyclin causes vasodilation of the blood vessel, and similarly they also inhibit the aggregation of the platelets. The second one is the thromboxane A2. The thromboxane produces opposite effects to the prostacyclin. Thromboxane is produced from the platelets, and they causes activation of the platelets and hence causes platelets aggregation and causes clotting. Similarly, the thromboxane also causes vasoconstriction of the blood vessel, and they also act as a smooth muscle mitogen. इसके बाद हमारे साथ आते हैं other products like prostaglandin D2, E2 and F2. The prostaglandin D2 increases mucus production, whereas the prostaglandin E2, which is an important one, and it causes fever. Similarly, it also causes pain. And both the D2 and E2 causes vasodilation, but the prostaglandin F2 causes vasoconstriction of the blood vessel. अब बात करते हैं about the inhibitor of the cyclooxygenase pathway. So the NSAID the drug which inhibit the cyclooxygenase pathway, and these NSAIDs have anti-inflammatory effects, antipyretic effects, and the analgesic effects. And these NSAIDs may be non-selective COX inhibitors which block both the cyclooxygenase 1 and the cyclooxygenase 2 enzyme. And the drugs include paroxycam, aspirin, and the indomethacin. Whereas the selective COX-2 inhibitor, they include the celecoxib, which selectively block the COX-1 COX-2 activity, and the COX-1 enzyme remain unaffected. The COX-1 enzyme is present in the stomach and the platelets. In the stomach, this COX enzyme causes release of prostaglandin, which has a protective effect on the gastric mucosa, whereas the COX-2 enzyme is present in the endothelial cell and it expresses during the process of the inflammation. दूसरा हमारे साथ है lipoxygenase pathway. In this pathway, the arachidonic acid is acted upon by the lipoxygenase enzyme. The first one is the 5-lipoxygenase enzyme. This converts the arachidonic acid into the leukotriene APO, and this leukotriene APO is then converted into the leukotriene BPO, and the BPO leukotriene acts as a chemotactic factor which is involved in the process of the chemotaxis, and the leukotriene APO may be converted into a leukotriene C4, D4, and the EPO, and this C4, D4, and EPO act as a slowly reacting anapilotoxin. The anapilotoxin, they causes the bronchoconstriction by acting on the bronchiolar smooth muscle. Similarly, they also lead to the vasodilation, hence there will be more fluid exudation occur in the bronchiolar lumen become narrow, hence they causes asthma. To inhibit the effect of these leukotriene, we give the leukotriene receptor blockers. The classical example is the montelukast, which bind to the leukotriene receptors and hence inhibit the binding of the leukotriene. There is another enzyme known as the peptine lipoxygenase, which causes the breakdown or conversion of arachidonic acid into the 15 hydroxyucosa tetraenoic acid, and this compound is this converted with the help of 5 lipoxygenase enzyme into the lipoxin, and these lipoxin inhibit the process of the inflammation. Similarly, the lipoxin is also pumped from the leukotriene APO with the help of 12 lipoxygenase enzyme, which convert this leukotriene APO into the lipoxin, and the lipoxin is the only chemokine having the anti-inflammatory effect. इसके बाद हमारे साथ आता है chemokine. So the chemokine are the freshly formed cellular mediators, and it belong to a family of the smaller protein, and these chemokines primarily act as a chemoattractant for the leukocyte, and the chemokines are divided into 4 main groups on the basis of the cysteine residues in the protein. They consist of the cysteine on either side, and in the center the extent for the amino acids other than the cysteine, and they are divided into 4 main groups. The first one is the CXC chemokine that consists of the cysteine on either side, and the center they consist of other amino acid. And this CXC chemokine is also known as alpha chemokine the interleukin 8. And this CXC chemokine causes the recruitment of the neutrophil and also the activation of the neutrophil. दूसरा हमारे साथ है CC chemokine. CC chemokine is also known as the beta chemokine, and it involves the attraction of all other leukocytes except neutrophils, and it includes MCP1 chemokine, which stands for the monocyte chemoattractant protein that causes the recruitment of the monocytes or the macrophages. The second one is the eutexin chemokine that causes the recruitment and activation of the eosinophil, and the third one is the ventis that is involved in the regulation of the normal T cell expression and the secretion. The third one is the C chemokine, which is also known as the gamma chemokine. This chemokine attract the precursor cell toward the thymus, and the important one include the lymphotectin molecule, which causes the attraction of this T cell toward the precursor T cell toward the thymus. And the fourth one is the CX3C chemokine. CX3C chemokine, they consist of cysteine residues on other side, and the center they consist of 3 other amino acid. And the important one is the pectalkine. And this CX3C chemokine acts as a chemoattractant for the monocyte and the T cell. And these chemokine, when they are released, they bind to the chemokine receptors on the leukocyte. Let's suppose it is a CD4 T helper cell. They consist of the chemokine receptors like CXCR4 receptor and CCR5 receptor, which are chemokine receptors, and these receptors there is always also the binding of the HIV ACA, and hence the entry of the HIV into the CD4 helper T cell ACA with this CXCR4 and the CCR5 receptors.